Hey everyone, this is Jason from Intricate Arch Spine and Body Solutions. You can check us out at intricatearchseminars.com. I wanted to talk to everybody today about scar tissue, right? So scar tissue is really difficult to treat unless you have one specific tool, and that's the use of dry needling, right? So scar tissue is really detrimental if it gets out of hand, right? It's our body's mechanism of kind of gluing things back together, but we can do a lot of things to significantly reduce the amount of scar tissue that's formed when you have tissue damage, right? So plastic surgeons, for example, they're trained to reduce the perpendicular tension on the scar, right? So if this is a scar going up and down, they want to reduce the tension going across the scar that way, right? So more tension on a healing scar causes more fibroblastic proliferation and collagen deposition, which leads to more scar tissue, right? So what plastic surgeons especially are trained to do is keep putting steri-strips over the wound, or however else they can reduce the tension on healing scars, and it makes the actual tissue heal more rather than healing with more scar tissue. And overall, it significantly limits the amount of scar tissue that's put down, and it maximizes regular tissue healing, right? So by dry needling around healing scars, it significantly reduces tension on the scar. It improves blood flow to the scar, right? And it improves tissue health. So it amplifies healing time, and it amplifies healing the overall quality of the healing is better too, right? Because you have less scar tissue. So ideally, you want to have as minimal scar tissue in your body as you can, right? So to needle scars, in general, you should wait at least 3 months to needle scars until they're actually healed. But I like to needle right around the scars immediately following surgeries and stuff like that, right? You get much faster healing. You get less scar tissue, and the scars don't keloid. They won't scar in either elevated or depressed patterns, right? And the coloring of the scar will be much more similar to skin color, right? So we know that needling releases melanocyte stimulating hormone from the brain, so we think that that's one of the ways that needling helps improve scar tissue color, right? So that was just talking about healing scars, right? So old scars are really easy to treat with needles too, right? And scars are really deceiving. Like, even if you've had your scar treated and it feels nice and soft on the top, I can almost promise you, unless it's been needled before, that once you hit that scar tissue about 1 centimeter down into the tissue, it's going to be like hitting a brick wall, right? And that's what happens with the needles, right? So even if you have scars that feel nice and soft on the top and they haven't been needled, and they are over a part of the body where you can needle deeply through the whole scar, like a knee replacement scar or a hip replacement scar, right? Those scars, it's super important to get needles all the way through the scar tissue once the scar is healed, right? And that helps take the crinkled up collagen fibers, which is how scars heal, right? And then it helps straighten out the collagen fibers, which makes a more mobile scar, and it also makes the scar tissue stronger, right? So another thing that needling does as far as scars go is it really regulates the autonomic nervous system towards homeostasis, right? So if you have a scar in your body, however you got that scar caused you to have sympathetic hyperactivity of your autonomic nervous system, right? So that's how the human body responds to damage, both mental and physical, right? So if you have scars that haven't been fully treated with needles, those scars produce latent, sympathetic, aggravating afferent signals to the brain, which short circuits your sympathetic autonomic nervous system, right? So even if you're not actively aware of the scar, right? If it hasn't been treated thoroughly all the way down to the periosteum, if it can be safely, that scar is going to continue to inhibit mobility. It could be painful. Even if it's not painful, it still is sending negative afferents to the brain, which is causing sympathetic hyperactivity, right, which is disrupting your autonomic nervous system homeostasis. And that disruption of autonomic nervous system homeostasis disrupts everything else in your body, right? Nothing functions properly if your autonomic nervous system isn't in homeostasis, right? So when I treat people, I treat any single scar I see, regardless of what it's there from. I see really amazing results with scars as far as mobility improvement, pain reduction. You can take old scars, right? I don't care how old they are. If you have scars that are indented down or raised up, right? As long as they're not significantly keloid scars and they're just those like kind of the nasty red, either raised ones or indented ones, you can flatten those scars out and turn them back as close to skin color as possible with needles. I really think that dry needling is the best way to treat scars that we have right now, right? I've had a lot of plastic surgeon friends of mine send me their breast reduction or breast augmentation patients, rhinoplasty patients, facelift patients, right? Once the scars are healed, needling into the scar tissue itself, right? And then also needling around the scar while it's healing dramatically reduces the amount of scar tissue formation. It improves healing time, and it makes the scar look much nicer, right? If you guys have any questions about this stuff, if you're a patient looking to get scars treated, or if you're a practitioner looking to advance your knowledge about treating scars with needles, it's really, really awesome. I think it's the most effective technique out there. You can email me at jason@intricateartseminars.com and check us out at intricateartseminars.com. Thanks.